know, cervical cancer used to be one of the most common causes of cancer deaths in American women.
Here to explain the root cause, symptoms, and ways to prevent the disease, Dr. Pallavalli Parsons with UT Physicians, along with patient Trisha Ann Hurd, who has a history of cervical cancer. Welcome to you both.
Thank you.
And Trisha, we'll get your story in just a moment, but doctor, let's start with the numbers. Just how common is it today, and what's driving the decline? Why have we seen over the past 30 years the decline?
Absolutely. Like you said, it was one of the most common types of cancers in American women. But with the advent of the pap smears and screening, we've been able to detect cervical cancer earlier and decrease that number significantly. This year alone, there'll be over 13,000 women diagnosed with cervical cancer, and about 4,000 women, or a little over, will pass away because of cervical cancer.
And the symptoms surrounding cervical cancer are sort of very similar to other things, right?
It can be. Usually early cervical cancer is asymptomatic, and it's usually detected with screening or a pelvic exam. But common symptoms include vaginal bleeding, bleeding after intercourse, or pelvic pain. Advanced cervical cancer patients tend to have pelvic pain, back pain, pain radiating down their legs, bladder, bowel symptoms. So there are a kind of array of symptoms you can feel.
And this is a cancer, as I understand it, that can affect a broad age group, right? Primarily caused by HPV?
Right. So HPV or human papillomavirus causes about 99% of all cervical cancers. And it is something that most women get affected with throughout their lifetime, but it's a transient infection. It comes and goes. It only causes problems when it persists, and if you don't take care of it, it turns into cervical dysplasia or precancerous cells, and if you don't take care of that, it turns into cancer.
And what about the age? Where are we seeing age-wise for cervical cancer?
So yeah, it is in a younger population, so it's like in your 40s, 50s kind of scheme, but not like our other cancers where you're seeing them in the 50s, 60s.
Okay.
Yeah.
And Trisha, let's get to your story. As we said, that you've had a history with cervical cancer. Talk to us about that.
Well, the reason that they found mine is because of kidney stones. I had been having all the pains that she was describing, but I chalked it up to premenopause, actually. And I was one of the probably lots of women that are afraid to go to the doctor, and so I would not go to the doctor. And the kidney stones put me in the hospital. And then after that, I had an infection that they couldn't figure out, and so my doctor sent me to a urologist, and they did a scope, and that's when they found the tumor. So.
And wow, look at these photos right here. So this was a pretty drastic event in your life. As you just shared, you were afraid to go to the doctor. I think a lot of people feel exactly the same way. But now your message is that if you're in doubt, you got to go get checked out.
Absolutely. Don't be afraid. It's better to know than not to know, and get it taken care of. Absolutely.
Yeah, be in that power. And as we're looking at these photos of you and your journey during your treatment, here is your soapbox. I mean, here it is, October, and of course we talk a lot about breast cancer, but it seems a lot of times those can go hand in hand sometimes. But here's your soapbox to tell people, don't be afraid. I mean, the journey is part of your story now.
Exactly. And from day one, like I was telling everybody, I put my story on Facebook. From the time I was going through the whole diagnosis to losing my hair, all the pictures were on Facebook for everybody. We named my tumor Ethel to kind of make it you have to go through it positively, and I had a lot of support, so I'm very blessed.
Today?
I'm cancer-free. I'm in remission.
All right.
Fantastic.
Thank you.
We love hearing that.
Thank you.
And in the case of Trisha and so many women, doctor, who are out there maybe ignoring these symptoms or attributing those symptoms to something else, you just mentioned earlier, I think it bears repeating, that the pre-cancerous stages are detectable.
Right. I mean, and that's what's driving all these numbers down. So get your pap smear. You know, women starting at the age of 21 can start getting pap smears, and we've added also HPV screening, so that test for high-risk subtypes of this virus that can cause cancer. And so when you turn by the age of 30, you can get a pap and the screening for HPV. And so that just significantly helps patients get screened earlier, detect precancerous cells, and get it treated, rather than waiting and having these symptoms that could potentially progress into cancer.
And what's really important too that I think that we need to talk about is the HPV vaccine.
Yes. 100%. And I mean, that is the one thing we have in our favor. I mean, the thing is, yeah, we've got screening. That's wonderful. But now we can potentially prevent cervical cancer and potentially even eradicate it. So the HPV vaccine was introduced earlier in the 2000s. It's approved for boys and girls, so we have to include both, from ages 9 to 45. It was only up to age 26 earlier, but last year it got approved to 45. For all of us that missed that vaccine and you're under 45, please go out and get it. And that can potentially help the acquisition of HPV, thus preventing cervical cancer.
And very quickly, because we're out of time, how early should we be vaccinating for HPV?
So it's approved from 9 to 45, but they're saying from 11 to 12, but it doesn't matter. Get it done. And not only does it prevent cervical cancer, it prevents anal cancer, penile cancer, vaginal, vulvar. There's so many other cancers you can prevent. Head, neck,
All right. Ladies, thank you so much for stopping by.
Thank
Trisha,
you.
thanks for sharing your story.
Thank you.
Glad to know you're cancer-free.
Thank you.
And in the meantime, if you would like more information or to schedule a consultation at the location nearest you, just visit utphysicians.com or give them a call, 888-4UT-DOCS.
Thanks again, ladies.
Thank you.